Today we'll look at the expected. So we'll look at the expected compensation. So expected compensation, this is in case of the acid-base disorders. The acid-base disorders. So first the disorder we are going to look at is the metabolic disorders. So what happens in the metabolic disorders? So here the expected compensation is we have the expected PaCO2. So this is equal to the 1.5 times the HCO3. So 1.5 times the HCO3, and then you add 8. This is plus or minus 2. Or there is another way, that is decrease in the PaCO2. This is equal to 1.25 times of the delta HCO3. Next we look at the metabolic alkalosis. So we look at the metabolic alkalosis. So what happens here in metabolic alkalosis? There is an increase in the PaCO2. So PaCO2 is increased, and this is equal to the 0.75 times of the delta HCO3. So next we move on to the respiratory acidosis. So what happens in the respiratory acidosis? Here we look at the acute as well as the chronic. So in terms of the acute, there is increase in the HCO3. So increase in the HCO3, this is equal to the 0.1 times the delta PaCO2. Next we look at the decrease in the pH is equal to 0.008 into the delta PaCO2. Next we look at the chronic. So what happens in chronic? Chronic, there is an increase in the HCO3, and this is equal to 0.4 times the delta PaCO2. And next there is a decrease. There is a decrease in the pH, and this is equal to 0.003 into the delta PaCO2. Then we move on to the respiratory alkalosis. So what happens in the respiratory alkalosis? So in terms of the respiratory alkalosis, again we have the acute and the chronic. In acute, there is a decrease in the HCO3. So there is a decrease in HCO3, and this is equal to 0.2 times the delta PaCO2. And then when you look at the increase in the pH, so there is an increase in pH, this is 0.008. This is 0 times of the PaCO2. Next comes, we look at the chronic. So in terms of the chronic, there is decrease in the HCO3. There is a decrease in HCO3. This is equal to 0.4 times the delta PaCO2. So this was about the expected compensation in case of the acid-base disorders. So we saw some primary disorders such as respiratory acidosis, alkalosis, to name a few. To learn and grow daily like this, please do subscribe.